Foundation in Chennai. She served in a few non-profit organizations in the UK, did internships with Apollo Hospitals in Chennai and with the Arvind Eye Hospital in Coimbatore. Social work is a passion with her. Gayatri wears other hats too. She plays a pivotal role in the Indian Prostate Cancer Foundation. She leads a charitable trust that is making a big impact in rural development. About Mrs. Poornima Rajan, she is a clinical psychologist and a neuropsychologist with a keen interest in community-based intervention for mental health and mental illnesses. Her professional goal is to make mental health care and psychological support systems accessible for all. She has been a rotaractor and interactor for several years. Gayathri and Poornima will now give us a presentation titled Combating Dementia in Words, Photographs and Video. Over to Gayathri and Poornima.
Thank you.
Dementia, a word that carries so much weight and yet remains misunderstood by many. Just imagine these precious memories seeping through like sand through our fingers. And also imagine that we're constantly trying to piece a puzzle together. That is the world of dementia for you. We at TDCF are huge advocates of early diagnosis so as to catch the symptoms early and give enough rehabilitation support for the elders so that they can continue to function at their optimal best. I am very proud to be working as a psychologist here because of the care that we provide for families that are navigating the challenges of dementia. We bridge the gap to reduce stigma and encourage socialization for elders with dementia to feel more connected and valued within their communities. Dementia can be very, very unnerving, and this routine gives them a lot of comfort and along with it a sense of belonging and security. At the inpatient care facility, we have round-the-clock nursing availability, doctors on call, and psychiatric supervision, which helps medically manage patients with complex or advanced dementia. It typically can show as memory difficulties, difficulty recalling names, finding their way and getting lost. These are very common symptoms of dementia. The Dementia Care Foundation is an NGO which was started in the year 2019 to help people elders with dementia lead a better quality of life for them as well as their caregivers. This collective effort positively impacts the well-being of caregivers, elders with dementia, and the community as a whole. When we start intervening just to the elder with dementia, but also to the caregiver.
At the daycare, we pride ourselves on conducting evidence-based cognitive stimulation therapy for elders with mild to moderate and even severe dementia.
We also provide support and training to caregivers to help them deliver with the best care for elders with dementia at their own comfort. The time that the elder spends at the daycare center, the caregiver can use that time to spend for themselves or to get their work done. Dementia cannot be cured, but we can slow down the progression of the disease with a perfect combination of medical intervention and cognitive rehabilitation. Together, we can make a difference. Thank you for being a part of this journey.
So that we saw the video, but that is not the end. இது முடிவல்ல, ஒரு ஆரம்பம், ஒரு புரிதலுக்கான ஆரம்பம், ஒரு ஏற்றுதலுக்கான ஒரு ஆரம்பம். I am hoping today's conversation triggers many more dialogues and opens up the door to the world of dementia. The stigma that surrounds it, the enigma behind it, and the myths that cover it, and the various perspectives to dementia. To many of us here, dementia may just be a word. And to some of us, it may be the new member in our family who we are all trying to adjust and slowly getting to know. And to some others, it may be the tsunami that has changed our lives forever. On behalf of all our elders with dementia, our caregivers, and our wonderful team at the Dementia Care Foundation, I thank the Rotary Club of Madras South for giving us this opportunity, and especially to Mr. S.R. Madhu sir for introducing us to this August gathering. And it was our moment of glory, because nobody has been so keen to write about us and post our pictures. I think he must have sent it to all of you, and he has also guilt tripped me in a way, because I think, and I know that he has spent more time on compiling all the work we do and sending you pictures than I put on the speech that I was supposed to give today. So as I was coming here, I was like, oh my god, so has put in so much effort, and I hope we make him proud today. Okay, coming to dementia. What is dementia? And to just give you a context of what exactly we are against, to give you the statistics. Can I have the statistics lights, please? Just to give you an idea of what we are up against, because we need to know. 138 million total population of elderly. This was the statistics in 2021, but it is expected to rise to 196 million, to increase by around 56 million elderly persons in 2031. That is approximately 196 million, of which elderly population is a huge amount. And of the elderly population, see, this study shows 7.4% for dementia in the Indian population aged 60 and above. And to give you a perspective of things, estimates suggest the number of elderly persons with dementia could reach 1.7 crores, that is 17 million by the year 2036. and the current population of Chennai is estimated to be around 12 million, and in 2036 we give. It is just to give you a perspective of things. ஸோ அப்படி பார்த்தீங்கன்னா சென்னையில் நம்ம எல்லாத்துக்குமே இந்த கிரேட்டர் சென்னை ஃபுல்லாக everybody has dementia. So that's the number that we are looking at, that's the figure that's staring at on our face. And by 2050, the estimate of dementia prevalence in India is estimated to be almost 20%. And that's quite a huge number. So what are we going to do about it? And dementia, the early onset of dementia. The other thing is, we are also noticing an early onset of dementia, and the rising incidence is something that we really need to be worried about. It is almost becoming an epidemic, and it is growing, and we still don't have a cure to dementia. So it is not just the personal toll that the dementia takes on the patient, it is also about the it has a huge impact on the economic and non-economic on the society. So when I say that, it is estimated that dementia in India will cost us over 300 crore rupees. But this is the amount that will be spent on medications, that will be spent on caregiving, and also the amount that will be spent on informal caregiving, the opportunity cost that goes into informal caregiving, where most of us, mostly women folk who could otherwise be in the workforce, will be at home taking care of elders. So that is the economic impact that we are also looking at. Apart from this, the emotional toll that it will take on everybody is very profound. And if you see a person with dementia, if you have met a person with dementia, you have just met one person. Because every individual they talk, they behave, they react differently. And it's not because of the stage of dementia they are in. It is because of the person they are. So, you cannot standardize or customize care to elders with dementia, especially when the rehabilitation happens. You have to work on them, you have to understand why they behave the way they behave. Of course, the medication part, the medicine part plays a role, and where you can have some sort of standardization. But then the rehab part, where you actually work on the mind of that person, why does he react? And if you see, it always goes back to their younger days. And so you really have to, so there is no one size that fits all in the case of dementia. So in general, now உங்களுக்கு நிறைய அப்படியே ஜென்ரலாக, rather than giving you facts and ideas and things that you might actually get off off the internet, and ChatGPT may be more eloquent in the way it gets this information across to you. So I just thought I will tell you real life stories. கதை இல்லை நிஜம் சொல்லுவாங்க இல்லையா, ஸோ அந்த மாதிரி what is our experience with elders with dementia? So sorry, oh I'm sorry. So what is our experience with elders with dementia? And I should tell you, it is a very gratifying place to be, very gratifying, and there are a lot of lessons that we have learned. So இன்னைக்கு 3 பேர்த்த கதையை சொல்ல போகிறேன், stories of 3 people, different backgrounds, and they're with us on different terms. So first வந்து கிருஷ்ணமூர்த்தி சார், மன்னார்குடியில் கவர்மெண்ட் ஸ்கூல் ஹெட்மாஸ்டர், கெமிஸ்ட்ரி வாதியார், ரொம்ப ஸ்ட்ரிக்ட் டிசிப்ளினேரியன். அவருக்கு ஆண் குழந்தை வேணும் ரொம்ப ஆசைப்படி. he had 3 girls. He had a very difficult and troubled upbringing, and he came up the hard way and he made his anger. But his daughters studied well, ella nalla, and they're all in different positions, but he was always avarku vandu, I mean, this is all the information that we get from his daughters, and we always go into, everybody is looked at as their stories, and what we look at them as the whole. ஸோ அதனால் அவருக்கு எப்போவுமே வந்து அந்த ஒரு ஆண் குழந்தை இல்லை, ஒரு இது இல்லை அப்படின்னு வருது. ஸோ வாட் எவர் தீஸ் கேர்ள்ஸ் டிட், இட் நெவர் ஸோ அப்படி பார்த்தீங்கன்னா அவருக்கு ஒரு unhappiness always it had been there throughout his life. And அதுக்கப்புறம் his wife, and he was not the so happy man always, and strict discipline and அந்த மாதிரி perfect headmaster role. And when his wife passed away during COVID, and then he had to come and live with his daughter here. Yeah. And they were very worried to leave him alone because of the person he was, and he did not have a lot of social interaction. அதெல்லாம் அவருக்கு இல்லவே இல்லை. வீடு வேலை இப்படி தான் இருந்தார். So he came here and he lived with his daughter. So because அவர் ரொம்ப ஒன்றும் பேசல, and then அவர் ஊர் விட்டு இங்கே கூட்டிகிட்டு வந்துட்டாங்க அந்த கோவிட் டைம்ஸில், and a lot of things played on, and and slowly dementia எல்லாமே it started setting in. And so our daughter is also working. I mean, the nuclear families near Kamari, they're all working, and a granddaughter in school. And இப்போ அவங்க போகணுன்னா என்ன பண்ணுவாங்க, so he was left at வீட்டில் விட்டுட்டு போவாங்க அவங்களோட. And then in this dementia, then they noticed that one day he was missing, and I start wandering, கதவை திறந்துட்டு போகிறது, all these சின்ன signs of, and it was very difficult to control. கேட்டால் கோபம் நிறையா வருது. And it was a very difficult household. It was difficult to manage him, and there's a lot of unhappiness. எப்போ எது சொல்லுவாருன்னு தெரியாது, கோபம் நிறையா வருது, எதுக்காக கோபப்படுறாருன்னு நம்மளுக்கு தெரிய மாட்டேங்குது. And he always had to be watched over. So இந்த மாதிரி இருக்கும்போது that the daughter had to take off work a lot of times, and was lucky that அப்பெல்லாம் we had work from home, but that was not what she could do all the time. So this was becoming very difficult. And so apana they approached us, and so Krishnamurthy sir came as inpatient to us. I won't call him patient. So it was about institutional care. So he came to us, and when he came to us, nothing changed. Our personality adhe maari da irundhudu. He was still angry because என்னடா டோட்டலா புது என்விரான்மெண்ட், யாருமே இல்லை, இங்கே கொண்டு வந்து விட்டுருக்காங்க, இவங்க என்ன பார்க்குறது. And there was a lot of sometimes yelling, there was a lot of frustration, then and all this. So our young girls, our psychologists and social workers who work with him, our nurses at the hospital, slowly என்ன தத்தா எப்படி அப்படின்னு சொல்லுனா கொஞ்சமாக பேசி சில டைமில் பேசுவார், சில டைமில் கோச்சிட்டு உட்காந்துருப்பார், இப்படியே போயிடுச்சு. And we are also trying to find out what is it that that there is that moment that clicks, and and for everybody. And so ஒன்று பார்த்துட்டு ஒரு நாள் சும்மா அந்த பாட்டு போட்டிருக்காங்க, பழைய காலத்து பாட்டு இல்லையா. And then அந்த பழைய காலத்து பாட்டு போட்ட உடனே, and then that there was a spark, and then there's a moment of some sort of relating to it and this thing. And that is when we realized that is something that maybe adu pannona we can turn him around. And so then they started playing a lot of இந்த மாதிரி பழைய காலத்து தமிழ் மியூசிக். And then we realized that he liked to listen to Tamil speeches, நிறைய அந்த காலத்து speeches. He was headmaster அந்த காலத்து, ஸோ அதனால we started doing that regularly. ரொம்பலாம் பேசவே மாட்டார் இது, and he was still unhappy. ஸோ போயிட்டு இருக்கும்போது, and then one day பார்க்கும்போது he said, ரொம்ப அழகாக பாடுறாங்கல்ல அப்படின்ட்டு. But that moment when he said that was a moment that he was relating to life, and he was identifying the beauty in life. So that was on the moment, it was a big win. It was a big win for all of us, for him. And then we knew, okay, inumela there is a turnaround. And that from that moment, every small konja interactions and you wouldn't believe it, and with all the cognitive rehab and all that, you wouldn't believe he is such a transformed person today. And as a matter of fact, and the cognitive testing எல்லாம் பண்ணுவோம் இல்லையா, ஸோ அதில் அவருக்கு ஃபஸ்ட்டு இம்பேர்மெண்ட் அந்த மாதிரி இருந்துச்சு, moderate class. Now it just says அவருக்கு it is just a impairment, it is not he doesn't fall under the dementia thing. So sometimes working on them, consistency and patience is what actually worked on him. And இன்னைக்கு காலையில் கூட சார் போடும்போது, நான் அவர் என்ன பண்ணுறாரு, இன்னொருத்தர் நடக்கும்போது பார்த்து நடங்க, மெதுவாக நடங்க, you know, there is such a transformation of personality, but a lot of times when we think dementia na memory loss, அதுதான் அப்படின்னு நம்ம நிறைய பேர் நினைக்கிறோம். But dementia is not about just memory loss. It is also about behavioral changes. It is about how people respond, and so that is another aspect of dementia. So that is Krishnamurthy sir. So இன்னொரு இது,
What is the duration?
1 year sir.
How old was he?
Sir is 80.
80.
He's 80 years old. Krishnamurthy sir. He's with us. I mean, and now he's become a part of our organization. Everybody knows him. Everybody our daily kala puja kurari. He's almost like one of the staff, and he இப்போ எல்லாத்தையும் ஜோக் அடிச்சுட்டு பசங்களோட இது பண்ணிட்டு he's good, and every day morning reads the newspaper. என்னமா இன்னைக்கு பாரு இந்த மாதிரிலாம் நடந்திருக்குன்னு சொல்றாரு. So you know, when I said it is a very gratifying job, it really is. You know, to see the transformation, and it is a non-judgmental space, if you ask me, between, you know, two people, or when we are talking to them, it is a totally non-judgmental space. Innoru kada, Chandra madam. Chandra madam, she came to us when she was 64. She was a joint director of handlooms and high post, dealing with a lot of IAS officers and somewhere down the line, you know, she started slowly memory loss, anxiety, இதேதான் behavioral இது மறதி, பேசினதே திருப்பி திருப்பி பேசிட்டு இருக்காங்க, கேட்குற கேள்விகளே திருப்பி திருப்பி கேட்டுட்டு இருக்காங்க, and கொஞ்ச நேரத்துக்கு மேலே the memory doesn't stay. இப்போதான் கேட்டிருப்பாங்க, நம்ம பதில் சொல்லியிருப்போம், ஒரு இமீடியட்னா நீங்கள் நினைப்பீங்க ஒரு லைக் ஒரு half an hour, அப்படிலாம் இல்லை, ஒரு 1 minute 2 தடவை கேட்டுருவாங்க கேட்ட கேள்வியே. So that was how more often that it was. And so she came to us, and there was a lot of anxiety in her. There's a lot of anxiety, and there was a lot of suspicion. அவங்களோட most important ஒரு handbag வச்சிருப்பாங்க. அந்த handbag she would just not let go. She had to have her handbag. வேற உட்கார்ந்திருந்தாலும் handbag கொடு, நான் ஆஃபீஸ் போனால் அந்த handbag கொடு. And the handbag was her a sort of obsession. Yes, it was her feeling of comfort, if you may ask. So that was, and the other thing is, our husband, a very nice husband, he's his caregiver, and daily கூட்டிட்டு வருவாரு, and she'll be like, எங்க போனார் அவரு, ஏன் இங்கே இல்லை, கீழே தான் இருப்பா, but then we had to tell her, இல்லை நான் போகிறேன் கீழே போகிறேன் அப்படிங்குவாங்க, இல்லை மேடம் வாங்க அப்படின்னு சொல்லிட்டு, then the girls will slowly get her involved in all the activities கொஞ்ச நேரம். And initially it was quite challenging, because every minute she'll be up and saying, போதும் நான் கிளம்புறேன். நீங்கள் அவங்ககிட்ட பேசுனீங்கன்னா ரொம்ப தெளிவாக பேசுவாங்க. There will be a lot of clarity in what she speaks, but she cannot hold the memory for more than a minute. மறந்துடும். திருப்பி அவங்க கேட்டதே கேட்பாங்க. இப்போ தான் சொல்லியிருப்போம், அவங்க ஹஸ்பண்ட் கீழே இருக்காரு, இந்த செஷன் முடிச்சோன்னே கீழே போகலாம் அப்படின்னு சரின்னு உட்காருவாங்க. நெக்ஸ்ட் நிமிஷம் எங்கே அவரை காணுமே அப்படின்னு திருப்பி எழுந்திரிச்சிருவாங்க. And then slowly we're working on her and getting used to her. And our handbag இருக்கு இல்லையா, அந்த ஹேண்ட்பேக்கை கையோட அப்படியே வச்சுட்டே உட்காந்துருப்பாங்க. And there were times when she sees things, she doesn't remember whether it's hers or not. சாமானை பார்த்தா எல்லாத்தையும் எடுத்து ஹேண்ட்பேக்கில் போட்டுப்பாங்க. And then we have to tell her slowly, இல்லை மேடம் இது நம்மளது இல்லை, இது இன்னொருத்தவங்களோடது. And then அப்படியா, then she put it back. And அப்படியே போச்சு. And slowly, distracting her and getting her involved in other activities. We do a lot of different activities and finding what she's interested in. எல்லாம் பண்ண slowly and the handbag obsession கொஞ்சமா போச்சு. Now her handbag is there and she concentrates and she does work. எல்லாத்திட்டையும் நல்லா Krishnamurthy sir and Chandraman, they all have a good conversation. அந்த காலத்து கதைகள்ல இருந்து நீங்க இந்த பாட்டு பண்ண, இந்த சினிமால எம்ஜிஆர் இது பண்ணாரு, அது பண்ண, they have a good conversation now, and she still asks for her husband, but it is not 1 minute ஒரு தடவைலாம் கிடையாது, இப்போ ஒரு 2 hours ஒரு தடவை இருக்காருல்ல அப்படிங்குவாங்க, இருக்காரு மேடம் he is there போலாம் அப்படின்னோடனே, and then now she settles. And I think the familiarity has also helped. And again here I think it is the consistency and the perseverance and the patience. Basically there are some people I think if it was music that clicked for Krishnamurthy sir, and then that spark and then that transformation happened. And I think here it was, getting her familiarized with all of us and the patients, and making her understand that, we are all there. And so I think that made the huge transformation. And the third story, இது கொஞ்சம் different, because all of us think that நான் இப்போ உங்களுக்கு ஸ்டாட்டிஸ்டிக்ஸ் காமிக்கிற போது கூட I said elderly population, இந்த மாதிரி தான் நான் உங்ககிட்டயும் காமிச்சேன். But I also said that there is an early onset of dementia, which is quite alarming. So இது Mr. Kannan sir. So he was holding a big one of the top management positions in TCS. He is 48, and when he came to us first, and luckily his wife, early signs of dementia, or mardi, or on the haziness, there is no, he is not able to concentrate, and luckily his wife was able to identify it early. But நீங்க அதை யோசிச்சு பாருங்களேன், ஒரு 48 வயசு, in the prime of their career, the children in school, son in 12th, daughter in 8th, and the wife is not working anymore. She was working, but their life seemed all well, and so she had given up her job, and ellame irukumbodhu, and then this dementia strikes, and it is a very, very hard blow, because we have seen a lot of families come to us, elders come to us, and then slowly acceptance sets in. But in the விஷயத்துல, இந்த இதுல acceptance is so difficult, because it is striking them so early. And when you have so many things about நீங்க elderly-ஆ இருக்கும்போது dementia வருது ஒண்ணு, but when you have the whole life ahead of you, dementia வருது, it is very, very difficult, and it changes your life forever. What happens to பசங்க ஸ்கூல்ல இருக்காங்களே, what happens to them? And the wife is not working, she needs to get back, but the wife, she accepted the fact that that's what it is, and immediately she brought, identified that it could be dementia. She took him to the doctor, and then she immediately brought him to the rehab, and all credits to her. She got back into working. She became a life coach. She is a life coach now. And sir வந்து எப்படி தெரியுமா, அவர் வந்து routine protocol பத்மநாபன் மாதிரி, அவர் ஒரு he likes to follow that routine. கரெக்டா வந்தானா அங்க நியூஸ் பேப்பர் படிக்கணும். We also have physio sessions for all our elders. அந்த டைமுக்கு கரெக்டா வந்துடணும். So he likes his routine. அன்னைக்கு காலைல ஏதாவது மழை பெஞ்சு வாக்கிங் போலன்னா, நான் இன்னைக்கு வாக்கிங் போல, that repeated, anything that changes from the routine disturbs his calm. So அந்த மாதிரி இருக்கும்போது, then we are slowly adapting him to that, things can also be little different அப்படிங்கிற ஒரு ஸ்லோவா இப்போ அவர் கொண்டு வந்துட்டு, but he gains strength from the familiarity, and the routine or familiarity, yeah. So that is one thing. So a lot of times we think life la vandu dementia only takes away things abindru, but I think in these stories la pathina, dementia also gives, sometimes I think it gives, here in this particular case, a lot of resilience, lot of it brought out the family, where you had him, Mr. Kannan, clinging on to the routine, the wife resigning to acceptance and getting on with life, and us giving them a structured program or a safety net, which brought them both together, and they were able to lead a good life. Son is in college now, Poornima all settled, and because he's here at the caregiver, நம்ம டேக் கேர்ல இருக்கறனால, she is able to go and work. தனியா இருந்தா then she will not be able to work. So yes, so these are the three stories. நான் ஏன் இதெல்லாம் சொல்றேன்னா, because it comes in different forms, so we just cannot say இப்படி நான் சொன்னேன்னா it will not be the truth, because, and I think everybody has a story. It is never about dementia அப்படின்னு என்னால சொல்ல முடியாது. So dementia is not the disease, it is always about the people. That is what it is. And there is one common thread that binds them all here, and that is resigning to acceptance. Acceptance of what is this? And breaking that bond of, and the stigma, the social stigma, and breaking that barrier of why me, that always happens. So the first thing that family, because it's very difficult, let's be honest about it, it is very, very, very difficult. So breaking the bond of why me, the social stigma, and then resigning to acceptance, and that is what helps them, come out of it and lead a better life. So there is this fact called social stigma, but there is also a self stigma, because a lot of times and the early dementia வருது இல்லையா, அப்போ you will still be aware, அப்பதான் onset, so you're not totally off the radar. So அந்த மாதிரி இருக்கும்போது the self stigma is when you feel ashamed about, you're feeling ashamed yourself about the symptoms, and you want to shy away from crowds, you're staying away, and that does not actually help. And the social interaction இல்லாத போது நம்மளே அப்படியே ஒரு குக்கும்குள்ள அப்படியே போயிட்டு இருக்கோம், and that does not actually help. So that is the self stigma. And also the being embarrassed, the caregiver being embarrassed of what will happen, what will people think, and what will happen, and that comes because of not being able to accept and not knowing how to handle it, the new normal abingiradhu. So once that acceptance comes in, then the new normal comes. And also the most important thing when this happens is asking for help. A lot of families don't do that. இது எப்படி போய் சொல்றது, அப்பா போய் எப்படி கேட்கறது, அப்படி கிடையாது. You have to understand that this is also a disease. நம்ம கை வலி, கால் வலி, any other disease of the organ, you have to understand that this is also a health condition. It is a condition of the brain. This is what is happening. So you have to go to the doctor. You have to go to the doctor. Early detection is so very, very, very important. So that is the most important thing. Early detection, I can't stress the importance of it. There are a lot of screening methods. MHC பண்றோம் இல்லையா, MHC master health checkup பண்றபோது there is no master health checkup that also has cognitive screening in it. I think you should also, we are trying to champion it, but I think master health checkups should also have cognitive screening as part of it, and you should do it after a certain age. It is good to do this, and there is always help available. Organizations like us, the Dementia Care Foundation, so it was started with this idea to help people, elders with dementia and their caregivers, lead a better quality of life. So this particular daycare center நடத்துறோம் இல்லையா, so we do a proper cognitive stimulation therapy. So நீங்க daycare center, it's not just a daycare center where they come and do. So their reports are written on the elders every day. What is it that they do there? How do they react? எப்படி பண்றது? Because நீங்க பாத்தீங்கன்னா அவங்களோட motor skillsல இருந்து எல்லாமே will change. So it is not just about their cognitive this thing. So everything is monitored, and because they are in a social group, they feel very nice. There is a sense of purpose. காலையில எந்திரிச்சோம்னு வெச்சுக்கோங்களேன், there is a sense of purpose. இன்னைக்கு எந்திரிச்சு நம்ம இன்னைக்கு போறோம், and that sense of purpose gives them a lot of dignity. சும்மா வீட்டில் உட்காந்துட்டு இருக்காரு அப்படிங்கல, எனக்கும் இன்னைக்கு காலையில வேலை இருக்கு, இது கட்டிட்டு கிளம்புற போது we have a vehicle, because we understand that logistics is very difficult. So we have a vehicle that goes home, picks them up, and then they come to us, and then they spend the day with us. And the day is full of cognitive stimulation therapies, and they do different artworks, they do physio, and then they read the newspaper, there's music, and all this that happens. And I think one of the best things about the daycare center is for the caregiver also. The caregiver, it gives them time to do what they want. And இது நீங்க அந்த stimulation therapy la, much as you can say, it is very difficult to do it day in and day out at home. You can't do it, and eventually it lead to caregiver burnout, because the இது இன்னைக்கு பண்ணிருக்கணுமே அந்த guilt வேற இருக்கும், நம்ம இன்னைக்கு பண்ணலையே அப்படிங்கிற guilt வேற இருக்கும். So some institutional care is good. Actually we are doing good for the elder, அவங்களுக்கும் ஒரு let out. So the daycare centers, this is what we do. We run a daycare center in Thoraipakkam and one in Mylapore also. The other thing that we do is inpatients. இப்போ நம்ம கிருஷ்ணமூர்த்தி சார் மாதிரி இருக்காங்க இல்லையா, this is for respite care. So இப்போ நிறைய இடத்துல பார்த்தீங்கன்னா there are two elderly couple living by themselves, and sometimes it's so difficult for them to manage. இப்போ பாட்டி அவங்க உடம்பு சரியில்லைன்னு வச்சுக்கோங்களேன், she just can't look after because she is also becoming old. So if there is a respite care, or if there is a function, she needs to travel but she can't take him. So there is respite care where the elders can stay with us for a few days, few months. It depends on the elder. தனியா இருக்காங்க ஒரு இதுல And there are also things, dementia, அப்படிங்கிறது there are a lot of centers. இப்போ now it is becoming like ஒரு என்ன சொல்றது, ஒரு fad மாதிரி. We also the senior citizen homes, இல்லையா, senior citizen homes with dementia care அப்படின்னு போடுறாங்க. But you need to be a little aware of, you need to understand what it is to deal with elders with dementia and a regular senior citizen living. There is a lot of difference. And so so it makes a huge difference when they're here. In the Mali, there are other dementia care living facilities, but anga irukumbodhu they are given proper cognitive rehab, and the nurses are trained to deal with them. To deal with an elder with dementia can be very, very frustrating, and if that nurse does not know how to deal with them, it leads to a lot of abuse. We are not there all the time. A lot of times the elders are abused, either emotionally, vaarthaigalala, illati sometimes physical kuda. We have seen it. So we also run a caregivers assistance training program. So this is for the family caregivers as well as the informal caregivers. இப்போ நம்ம வெளியில இருந்து இந்த nurses எல்லாம் எடுக்கிறோம் இல்லையா, ஸோ அவங்களுக்கு how do you deal with elders with dementia அப்படின்னு தனியா we run programs for them periodically so that we can train them so they can specifically deal with elders with dementia. The other thing that we do is awareness programs. Of course, the most important thing is stressing on the importance of early screening. And I think early detection leads to, awareness leads to early detection, and early detection, gives a lot of, you just can make your life so much better. I think working with the Dementia Care Foundation, they say they wear a lot of hats, but I think my most favorite space where I said is non-judgmental, and my this thing where I can just be myself is here at the Dementia Care Foundation, and it has taught me a lot of lessons. And one of the most important lessons when I've seen the families and paathumbodhu is learning the art of letting go. You just have to sometimes let go, but I'll tell you what makes it more difficult. It makes it very, very difficult when you have to let go before you have had the time to say a proper goodbye, and to say a proper goodbye to the person we knew. He's there, and I think one of the most hardest things of life is to grieve for a person who's still alive. So it is not easy. Dementia is not easy. It can happen to any of us. We need to be ready. We need to, Poornima will take over now and she tell us. But I'm saying there are a lot of things. Early dementia, if you do a proper cognitive screening, and if you're aware of it, if you do it, and then you can plan your life, from your finances to the legal issues to who will take care of you. There are advance directives. There are so many things that you can plan to make life better. Not that I'm saying we are going to get dementia, but I'm just saying what are the things that we should be looking at. It is just like any other diabetes or hypertension.
Causes it. Everything is after it already happens. Can we prevent it, or
Yes.
what causes it?
Yes, and
That
that's
is
what
very
Poornima is going to talk about now. Over to Poornima.
Thank you so much. I'm going to go into a bit of the formal aspects of dementia and so on. So, what is dementia and how is it different from normal aging? Is that normal aging, what you can expect is there's a little bit of slowing down of how fast we do things. So, something that we do, let's say a particular morning routine that takes 10 minutes, as we get older, it might go to 15 minutes, 20 minutes, or maximum 30 minutes. Dementia, on the other hand, is I'm not able to complete the task. I start it, but I'm not able to complete it. So if my routine is I wake up in the morning, have my cup of coffee, take a shower, get dressed. I wake up in the morning, have a coffee, I take a bath, but I forget what to do next. So that is a few signs of how it differentiates between dementia and normal aging. So to answer your question, how do we prevent it? So a lot of current science studies that are there in medicine is to try and understand why there isn't a solution for dementia as of now. So with how much advances are there in neuroimaging, in brain pathology and blood work and so on, what we have identified is that the reason we're not able to come up with a cure is because the changes in the brain happen almost 7 to 10 years before the symptoms start to show. So that is something that is quite stressful, I'm sure. Yes. So as of now, the reason that most people say is genetics, but then very recently, as recent as maybe 3 years now, they found that the changes in the brain starts much earlier, and it's only after like 7 years is when slowly the symptoms start to show. So when we talk about preventive health, as of now, the preventive solution that we can have for dementia, early onset of dementia, is lifestyle modification. Maintain a really good active lifestyle. Take care of your health parameters, just like how we have an open conversation for diabetes, hypertension, for obesity and so on, and we say, eat healthy, walk and so on. The same process also applies for dementia. One add-on for dementia is also be cognitively active. So when we plan for retirement, where we work really hard during our younger age and we say, when I retire, I'm just going to put my legs up and I'm not going to do anything, I would suggest plan to be a lifelong learner. Engage in these kind of social events where we have something that we're working on, because that is the best way in which you can prevent dementia from starting up. So why is this an important conversation post-pandemic? And this is something that both Gayatri madam and I have been working on. Pandemic really disrupted our lifestyle. We're so used to going out, doing everything, like doing many things in a day. It's not just work at home, but we used to do a lot of things, and that came to a halt in the pandemic. There has been a significant increase in the number of people who have reached out to us for help for their elders, only because the disruption caused them to have some dementia-like symptoms and so on. So, which is why we're also seeing more younger adults becoming, showing signs and symptoms of dementia. So, let me quickly walk you through what dementia is about. These are the different treatment options, but I'll come to that in some time. What we know about dementia is most common is that there is Alzheimer's disease. And then there is another common one called as vascular dementia. Alzheimer's disease is because of there's a particular protein in the brain and so on. Vascular dementia, on the other hand, is because of the blood vessels in the brain, like how either because hypertension or diabetes can either start to have small ruptures or small clots that can affect memory and so on. There are other forms of dementia called Lewy body dementia and frontotemporal dementia as well. But the underlying feature that you can expect off of dementia is that initially there will be a cognitive difficulty. Cognitive difficulties, difficulty with attention, memory, language, visual spatial, depth perception, and so on. And there's also behavioral changes. So in the sense that let's assume that I have a puzzle, the puzzle is not fitting very well, and because of that it's creating some amount of anxiety for me. So a lot of the times before a memory experience can show, you'll suddenly notice that the elder is experiencing a lot of anxiety and sort of unsurety. Am I walking correctly? Or I keep checking to see where my pen is, where my keys are, and so on. So just this sort of a little bit of anxious patterns start to form. What we can do to help if we see that someone is experiencing something like this is, rather than assuming that it's okay, it's hot outside, or they've not eaten properly, it's fasting season, instead of assuming that these are the causes, if you see something like this in somebody that we know or we care for, it's always a good idea to very quickly just go in for a quick screening. A screening is less than 5 minutes. It doesn't take more than that, but it can really help in understanding if an elder has a propensity towards developing a cognitive impairment. Why are we stressing so much on early detection? Is because the amount of rehabilitative exercises and the amount of support that we can give someone who's in the early stages of dementia really helps. It improves their quality of life, it improves how much support we can give them, and it also improves the overall well-being of the entire family. But what we have observed since we were caregivers at one point, as well as now, is very often the elders come in only when they're in the later stages of dementia. So at that point, sharing that, there's not much of options that are available to them then, is both grieving for the family as well as for us as well. So one of the major parts that we focus on is early detection and early intervention for elders. So when you notice someone has something like this, is going through a difficulty of this sort, where do you reach out for? Or who do you reach out for? The first person is your general physician, your neurologist. If it's anxiety or if it's more behavioral, it's the psychiatrist. going in for a cognitive screening on a regular basis, either to our center or with the psychologist is helpful. And after that, depending on the elder's needs, they can also reach out to physiotherapists, occupational therapists, speech language pathologists, and social workers. These are your care team. So dementia is not only a medical experience, it's also a psychosocial experience. So you need to have an entire team in place. So currently the mode of treatment that are present, medication wise, there are certain medications that have been approved for the memory side of it. There are certain medications that are approved for the behavioral side of it. But only medication support is not enough, because like we mentioned, the changes are in the brain, and the brain is a muscle. So as long as you keep that active, the more comfortable and versatile and happy the elder will be. The less active we are able to keep, or less engaged we are able to keep the elder, more irritability, agitation, sleep, appetite changes you will notice. So there's a little bit of lifestyle experiences also in place. To help with that, having places of centers of excellence like the Dementia Care Foundation and so on can help, because you can build a system in place. The entire role of care is not through one person or two people. There are smaller set of people who can handle smaller aspects for the elder, so it doesn't add too much of stress or frustration onto a single person. That's the plan. Can you go to the next slide? So what we are also working on is primarily, and what we're looking for in terms of partnership, and this is an open conversation with everybody from schools to colleges and outside, is to get the community to get involved. One of the striking features of dementia, not just for the elder but also for the family, is the second that there are gaps in memory, very often the first thing that we notice in the family member as well as the elder is they will withdraw, because they don't feel that they're able to do things well enough, or that people are starting to notice and be like, hey, but why? Why is this happening, and so on. It's very important that we empower the community to prevent or assist the families who are starting to withdraw, but allow them a warm welcome so that they can engage with them. The power of a community can really make a positive influence on the elders and so on, because they have a routine, they can come and meet their friends, they can come and be a part of an entire exercise. We are able to really see the difference. Or during summer camps, for example, when schools are on, we have intergenerational camps that we run during summer vacation and so on, where when the elders interact with young school students who are able to have the patience and the excitement to work with the elders, the amount of psychological impact that comes out of that, the elders stay giddy for months because they get to spend that time. So the importance of a community engagement. What we're also looking for is to break the stigma that's around it by saying it's okay to reach out, rather than saying, illa wait panni paakalam, unnu oru maasam, unnu oru 6 maasam, unnu oru varsham. Instead of giving that, but to say no, go. Whatever it is, we'll handle it, but let's go first. So those are the two major parts where we really are working with a lot of the community-based initiatives to try and work on that. So we're looking for a lot of people who are willing to volunteer. We're looking for a lot of people who want to learn about dementia. That's why we're the CATS program going in, and also be a part of the caregiver support system. So we truly believe that if the way we can have conversation around cancer or AIDS for that matter, if we can have a conversation around dementia, a lot of things will change in the dementia care space itself. So that's essentially what we are working for. If there's any questions, I'd be happy to take.
Yeah.
What's the difference between vascular dementia and the other one, that is the
Alzheimer's? So Alzheimer's dementia, so basically the brain consists of about 4 different lobes. There's the frontal lobe, temporal lobe, parietal lobe, and occipital lobe. And Alzheimer's dementia predominantly is caused because of a particular protein called the prion protein that tends to over accumulate in the brain, making it difficult for the brain to function. And the clinical aspects of a person with Alzheimer's disease predominantly starts with what is called a short-term memory loss. Short-term memory loss is newer memories. They have a difficulty with newer memories. Prior that when they're in school, colleges, when they're working, their ability to articulate their memories then is much better than maybe what happened last week or today morning and so on. So that's the first indication. And because it's a protein development, they'll have difficulties across the different cognitive functions as well. A little bit of memory, little bit of language, little bit of how did I come here, what bus did I take. So a little bit of memory loss across these areas as well. But if it's vascular dementia, Vascular dementia is caused because of blood vessels that either get clogged or get burst, like typically like stroke, for example. So it depends, it can be a part of the brain. Like for example, if you had a stroke and it's affected your frontal lobe and your temporal lobe, you'll have more of executive difficulties. எல்லாமே எடுத்து வச்சிருவேன், I'll keep everything together, but how to put it together to create a product will become a problem. Processing speech, executive function and more. And language specifically will become difficult. Instead of saying I want to take a carrot, I might keep saying police, because the language area where I'm supposed to pick up that word from my memory becomes a little hard. So you'll notice very noticeable changes in these two spaces, but otherwise the functioning is all right. So those are the slight difficulties.
Taste, like we know HbA1c, you go and check.
Yes.
Things are very easy for common people to go and get it done. Is there anything which we can just regularly have a look? People can just go and have a test. What is that?
So
Through the blood test or something, in any other way?
So blood tests are something, at least in the recent past, there are a lot of evidence that suggests there are certain blood tests which you can do to identify, early onset.
That's good.
But the studies are still out. It's not conclusive yet. It's exciting, but we don't know whether it is there yet at this point. Typical, whatever you do for your health parameters, your HbA1c, your homocysteine, all of those elements do indicate to possible propensities towards dementia, because like we mentioned, vascular dementia means if you have diabetes, hypertension, the more severe it is, the more chances the brain gets affected. Something like that we can use. But what we advocate as something that is a little bit more present is to do cognitive examinations. There are certain assessments that are there. It's called mini mental status examinations. It's about 30 questions, very simple questions like, what is today's date? What is the month? Can you count back from 100? How do you spell ocean backwards? Some very small exercises like this, unless and until your brain has a difficulty conceptualizing this information, it's very difficult to falsify the data. So it's a good idea that once in 6 months or once a year, just go ahead and do this as an assessment. It takes less than 15 minutes. But if there is certain parts where there is a struggle and that struggle feels real, it's something that you can address much earlier than you can address later. There are certain neuro-strengthening medication that's available, I would suggest you meet a neurologist or a psychiatrist before you take it. But that is more like nutrition to the brain as opposed to a curative agent. So that's why we're focusing a little bit more on the preventive health. If you're a younger adult, and we really want to, and if we have a genetic propensity for dementia, I would really suggest revisit your lifestyle, revisit your habits, and if you really think you can alter it, please go ahead. Whether it's diet, exercise, drinking, smoking, all of that stuff, do try and keep it within healthy bounds, because all of these can definitely add to your later part of your life being more healthy and happy and so on. So,
Ma'am, whether a genetic profiling help us to find out whether there's an inclination towards
yes, genetic tests do help. Genetic tests do help to understand whether there's a genetic propensity towards it. It doesn't necessarily control your ability to get it. Neither can we do any intervention around it to say that you can cure the genetic elements. But family history also can help. When we talk about dementia, we also have other associated disorders like Parkinson's, for example. So all of that comes under degeneration as a concept. So if we feel like we have a family history towards it, it's better we take better care of our health. If we are looking at retiring, please retire with good finances, as well as allow yourself to be, or take an oath towards lifelong learning. Keep learning something. As long as you do that, your brain's going to be healthy, it's going to be wet, and it's going to be fun.
Post recovery, okay, after the rehabilitation, okay, does he need to undergo the same routine?
Pardon? Sorry, I didn't get
Post
it.
recovery, after the rehabilitation,
Right.
whether he has to undergo the same rehabilitation continuously, or he can be normal?
So it's a very good question. Certain neurological disorders, you can go, there'll be a period of rehabilitation you can do, and then afterwards you can stop. Like for example, if you've had a stroke or if you've had a head injury, your rehabilitation that you need to do to regain some functions will be about maybe even 3 years or so, but afterwards it can be fine. But dementia, because it's a degeneration condition, you have to have it lifelong. Because it's a muscle, so as long as you lift weights, you can carry that load. The second you stop, even for a week of vacation, you come back, you'll realize you can't lift that load anymore.
No
So that's what
headache or
dementia is.
anything, side
Sorry?
that you get lot of headache, then you at least think of cognitive test. Why should someone think and go? We never thought of it before Madhu said that.
See, that's
It
the.
all struck us now. So
That's
how
one of
do
the
we
reasons why.
get to this? That's what the why.
I think awareness is the only way at this point. We need to know that something like this is there. So we just have to.
It's
a
like
good
the
idea to
MHCs,
build
madam,
it.
that we just take master health checkup panikrone. We do the MHCs as
Yeah.
no, because now we
So
have
they
realized
should,
the
you should
importance.
ask the
Yes.
government to include with the master checkup. This should be also part of it.
That's true.
Yeah.
That is true.
Sir, that is
We need the.
I have never had a thought of it also. But once this later came, it struck me. Oh my God, this is one more side.
So I think that's where the community support helps, where we can open up the dialogue for something like this, because it's not easy for a smaller set of
The
people. to
stupid
be able to
Apollo also does not do.
Okay, ma'am. Ocean, spell back.
Stupid Apollo.
Okay, I just want one. We'll start with the test. Can you spell back
Yeah, yeah,
ocean?
I just in my mind.
No, no, actually automatically happens.
It's
I'm
still
sure
like
everybody
it.
in the room started
It's still
spelling
like
it
it.
back.
Spelling ocean back.
Yeah,
Do you,
it's
do you,
still like it.
do you have a method of self-assessment, like a kind of questionnaire where you can assess your cognitive? It makes it easy, right? I mean, if you can, probably if you send us a questionnaire, we'll self-assess ourselves for a beginning to see whether we are falsifying the answer. Probably we can get it a third-party intervention as well. to give
Immediately I
us
did it. Ocean.
Yeah.
Immediately. Started.
So I think self-assessments are there, but I wouldn't recommend it because,
No, with a third-party intervention. If
Yeah.
we are going to do that, definitely we are
Yeah,
not
I
going to
will
falsify
think
ourselves.
always I am good.
Yeah, that we will
I'm
not
best.
falsify ourselves.
So
So then,
what we do is if like what we prefer to do is to have like one of our persons just come in, we'll do like a quick assessment for
Rotary
like those who are
President,
interested
please
in-
organize
Yes.
all our Rotaries and hands.
One second.
What I want to ask you is, very often, the early onset where you said you need to do the screening early, there's tremendous resistance
Yes.
from the elderly. The moment you talk about it, they become wild.
Yes.
It's not easy
Yes.
to get that person to your center for this. Is there something which can be done at home, or is there a way, where you can sort of slowly get that person to accept assessment?
So we actually, during our previous exercises when we started doing awareness program, this was a very common, this was a very strong conversation that was there within the organization. We understood 2 or 3 major hurdles that came into allowing for acceptance or to come in and take help. Number one is the fear of loss of control. So I, at some level, know that I'm not doing well enough. It's difficult for all of us to let go of our independence, let's be honest. As children, we've been craving for it. Once we have it, we don't want to let it go. That's the way it is. So at some level, I know that that's something that's setting in. The first fear for the elder himself or herself would be that if I were to voice this out, will my independence be taken away from me? Will my family tell me, oh, you can't handle these things anymore, so give it to us, we'll take care of it, which is not great. It's not a good feeling. The second thing that happens is that if people come to know about me, come to know that I have something of the sorts, and I'm worried I might have something of the sorts, will someone harm me? These are very acceptable concerns as an elder. And the third thing is the fear of being a burden. Right? So these are the 3 things that are there. If we can work together and find a form of messaging that can help normalize this or kind of help the elder feel warm enough to know that it's not a threatening environment but a safe environment, I think we'll do well. I personally don't know how to crack it. We've tried our level best, but I think getting others to be a part of the dialogue and then know that it can be a conversation over a cup of coffee, I think that's the best way to go. We've not cracked that yet, to be honest, but I would love to figure out a way
I
to do
totally
that.
connect with you because my dad had Parkinson. So initially when we diagnosed that he had, right?
Yeah.
So he was not able to accept himself, and
Yeah.
the different questions that you said, right?
Yeah.
That acceptancy levels was kind of like
Yeah.
seemed like
Yes.
Yeah.
So the current strategy is to empower the family members to look out for these signs, and if they see it, they can gently nudge the elder in that direction. But that's a temporary fix. It's not the permanent thing. I would really like to have a conversation where people can talk about dementia and not feel it like something that they need to hide from. That's the
early stage when it can answer.
Yeah, Rajesh, one last question, please. Yeah.
Yes.
Does the family also participate? Like, for example, I bring one person and the other person brings their family member. Do they swap and join the activities in the center?
There are definitely elders who are very comfortable doing that. That is there. I think over the years of us running the center, the attitude of the overall family and the kind of elders we're getting is much better. Like, for example, just the conversation around mental health has gotten a lot more easier after the pandemic. Similarly, the conversations for the caregivers to seek help has also gotten better after the pandemic. But it's within our space, like what Gayathri Madam said, it's a safe space, so they're very comfortable there. Would they carry that same level of comfort outside, even outside of their immediate circle? I would say the current answer is not much.
I think his question was different. His
Yes.
question was whether there's a support group, the family members, whether they form a support group.
We have support systems.
Yeah.
We
Caregiver
have
support
support
group.
Yeah, we have caregiver support groups as well, and internally they do help each other as
Yeah,
well.
that's
That
what-
is there.
It's one way of bringing them into the
Yes.
Yes. So family members are they're very comfortable once the system is in place. But to find that a facility like this is available also is actually quite difficult. Because for every one person who's willing to push them in the direction, there's about 10 others who are telling them not to take it up.
Just to wrap up,
Yes.
do we have exercises like people go to gym to get the physical self?
Yes.
For the brain, like you said, you have a set of 30 questions.
Yes.
Or 50 questions. So is it like every day you practice those 50 or 60 different questions to keep your brain also like a gym?
Okay, so that is a screening assessment. That is not.
Before the answer.
If you're looking at brain gym, there's some wonderful exercises we can do. Number one, stop using ChatGPT or anything else for your major problem solving
Exactly.
skills.
Yeah.
Attempt at problem solving first, and you can use that as a guide. We are in a generation where instant gratification
No
is the thing.
reminders.
No reminders. I think the day we started having ability to note down phone numbers in our phone, we have lost the ability to remember more than 5 numbers. These are all not good things, because the more lesser load we take on our brain, the less reason there is for it to function. So as much as possible, do things on your own. Allow for you to feel that frustration, but still continue to do the effort. Don't let go of these everyday activities. Exercise helps. Numbers, accounting, handwriting, everything, journaling, all of those things help.
Remember your wife's birthday.
Yes. Birthdays, anniversaries, all of that, yes.
Physical health also.
Yes.
No, Sudoku, I think.
Sudoku can help. Socialization is brilliant.
That's
why Raji has got
That's why Raji has got a good, no problems. Raji is a Sudoku expert.
One last question from Siva. Yeah, please. Siva, go ahead.
Are there any dietary best practices?
Dietary
best practices, because most of them state that it is because of the oxidation that is there, oxidation level that exists in the brain.
So better.
The neurotransmitters doesn't work that much effectively. So with this being the case, I'll let you explain. So when you go to a neuropathic doctor, what they say is it's all because of the serotonin that is not produced enough in the gut. That there is something called as a vagus nerve that connects from your gut to the brain, which is not signaling anything properly, and that more number of antioxidants have to be produced in the brain in order to get the brain function effectively and also the neurotransmitter function effectively. So there is also something called as a vagus nerve stimulation.
Yes.
So do you do vagus nerve stimulation first thing, and second thing is, do you suggest any best practices in terms of dietary aspects?
So dietary habits, number one is just a general healthy diet. Whole food diet is a very good option. There's a lot of studies around coconut oil and walnuts that are supposed to be good for the brain. That is there. At this particular junction, all of that comes under the lifestyle modification segment. It's not curative by nature, but it does help. Reducing on fats, reducing on any of the kind of food that we eat that leads to unhealthy habits, that all, including sugary foods, alcohol beyond a particular age, and so on. All of that is still recommended to a large extent. Having a healthy eating routine is good, not to have a mixed routine, so that helps. So as of now, all of this come under behavioral elements that can support an allopathy related lifestyle. That's definitely helpful. Elders, as they age, they are prone for urinary and gut issues that are there, so it's a good idea to reduce on this, to keep that healthy and easily digestible, because that does affect to some extent how you function on a day-to-day basis. So there's no specific diet for dementia, unlike just some nutritional capacity, but it's good to allow the body to feel flexible and healthy as opposed to feeling loaded and constipated and stuff.
Serotonin is the one which controls the mood swing, the behavior, etc.
Yes. So as the degeneration happens, neurochemical changes do also take place, which is why we have the behavioral aspects as well. To some extent, the brain, the nutrition can help, but depending on what the elder needs, you need to have a supervised regime in place. There's no generic element.
Like nutrition coupled with the dietary best practices.
Yes, but it depends on what you're trying to address. So there's no generic idella edutha nalladunu solla mudiyadhu. So you have to, at that point,
We'll
the
take it
person has to
offline,
go.
yeah.
Yeah.
Sorry, we'll take it offline.
Yes.
But anyway, you have a follow-up speaker. Shiva seems to be very knowledgeable. We can fix it for the next meeting. Thank you very much,
Thank you.
Poornima. Thank you very much.